All right, let's talk about something that so many of us experience but often don't really talk about: vaginal discharge. We're going to cut through all the confusion and concern and just break down what's actually going on based on trusted medical facts. So let's get right into it. Here's what we've got lined up. First, we'll figure out what normal even means for you. Then we'll meet the three most common culprits. After that, we'll see how a doctor actually figures out the cause, what the right treatments look like, and finally, we'll bust some major myths and cover the do's and don'ts. Okay, first things first. Before we can even talk about what might be wrong, we have to get a handle on what's right for you. This part is all about understanding your own personal baseline, because that's really the only thing that matters when you're trying to figure out if something has changed. So this is really the big question, right? It's the one that sends us searching for answers. What's the actual line between something that's totally fine and something you should be concerned about? Well, the answer is probably a lot simpler than you think. Here's the official medical term, fluor vaginalis, and I want you to notice the most important part of this definition. It's not about some textbook standard, it's about whatever deviates from what is usual for her. That's you. The main takeaway here is that you're the expert on your own body. Abnormal is just any change from your personal normal. And hey, if you've ever felt like something was off, you are definitely not alone. I mean, look at this number. A massive 75% of women will get at least one yeast infection. It's one of the most common things doctors see. So there's absolutely no reason to feel weird about it. Let's just focus on the facts. Okay, so now we know we're looking for a change from our own normal. So what's usually causing those changes? Well, let's meet the usual suspects, the three things that are behind most of these symptoms. Now, before we get into the specifics, this is a really important difference to understand. Think of it this way. Bacterial vaginosis, or BV, isn't really an infection in the classic sense. It's more like the ecosystem of good and bad bacteria just gets thrown out of whack. On the other hand, a yeast infection or trichomoniasis, those are actual infections caused by too much of a specific fungus or a parasite. This little distinction is actually key to how they're diagnosed and treated. All right, this table really lays it all out beautifully. Let's break it down. For a yeast infection, the number one symptom is usually intense itching, along with that classic thick, white, clumpy discharge. And notice the pH stays normal. With bacterial vaginosis, the main clue is a distinct fishy odor, paired with a thin, grayish-white discharge and a pH that's gone up. And then there's trichomoniasis, which is an STI. A lot of times it has no symptoms at all, but when it does, you might see a yellow-green, frothy discharge and a significantly higher pH. So you've noticed something's different and you go to the doctor. What actually happens? Let's pull back the curtain on that process. It's not some big mystery, it's really just a bit of logical detective work to figure out exactly what's going on. It almost always breaks down into these three simple steps. First, you'll just have a conversation about your symptoms. What's been going on? Then there might be a quick physical exam. And finally, there are some really simple tests that can be done right there in the office to get clues almost immediately. And for BV, here's a perfect example of that detective work in action. It's called the Amsel criteria. A doctor knows it's very likely BV if you have 3 out of these 4 things. And get this, the first 3 can all be checked in just a few minutes, right in the exam room, without even needing a microscope. They check the discharge, test the pH, and do a quick whiff test. Pretty simple, right? Okay, so the detective work is done, you know what the cause is. Now what? We move on to the solution. And this is exactly why getting the right diagnosis is so important, because you have to match the treatment to the specific cause for it to actually work. Now this might be one of the most surprising and important things we'll talk about, and it's straight from the official medical guidelines. For both BV and yeast infections, if the symptoms aren't actually bothering you, you don't need to treat it. Seriously, the body can often sort these things out on its own. Treatment is all about making you feel better, not just wiping out some organism for the sake of it. So when you do need treatment, you've usually got 2 main options. You can go with a local treatment, like a cream or a vaginal tablet that works right at the source. This means fewer side effects for the rest of your body, and it's the top choice during pregnancy. The other option is a systemic treatment, which is just a pill you swallow. It's definitely easier, but there's a higher chance of side effects. Which one is right for you is something you and your doctor can decide together. This question comes up all the time, so let's make it super clear. Because BV and yeast infections aren't considered STIs, the guidelines say there's no need to treat your partner unless they're also having symptoms. Now, for trichomoniasis, that's a different story. Since it is an STI, treating your partner is absolutely essential. All right. For our last section, let's just cut through all the noise. I mean, there's so much advice out there about vaginal care. Some of it's good, some of it's bad, and some of it is just wrong. We're going to focus on simple, proven advice to keep things healthy and balanced. When it comes to hygiene down there, the main rule is pretty simple. Less is more. All you really need to do is wash the outside area, the vulva, with plain water. Things like douches and scented soaps can actually mess up your natural balance and create problems. Oh, and here's a big myth buster. The official guidelines say there's no real evidence that things like tight pants or panty liners are the culprits here. And here we have it, a direct quote that shuts down some of the most popular home remedies. The idea of using yogurt or probiotics seems to make sense, right? But the actual science just isn't there to prove they work. In fact, doctors actually discourage using them for an active infection because sometimes they can cause more irritation. So at the end of the day, understanding all of this isn't just about knowing facts. It's about getting rid of fear and confusion. It gives you the power to talk confidently with your doctor and, most importantly, to trust what your body is telling you. Because knowing your own normal is probably the most powerful health tool you've got. Thanks for joining me for this explainer.